Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? This one is sad. From my old roommate girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they're giving her a lot of pain in her last months. They were almost 60 years old and taking a drug to make them lactate so their husband could pump them as it would help their fibromyalgia. Took a while for them to admit why they were taking it. Nurse here had a patient accuse me of shitting in her bed and threatened to sue me for malpractice. Keynote: she never got out of her bed. Had an elderly lady from a nursing home come in super altered. She would wake up briefly to answer questions but then would be out like a light seconds later. Usually in this case we assume it's from infection, stroke, etc., but we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator, since she was getting worse, we cut off her bra and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan and she gasps herself awake. Even after that still took her a long time before she said, well, maybe I did take some drugs from a friend. Since then I've trusted no one when it comes to denying drug use. I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. How stupid can parents be? Don't they understand the risks? Had a patient in hospital, I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM, massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the pub and just drank lemonade. Okay, we say, we're gonna take some blood and find out what you've taken. He then pipes up the friends he was with would think it was funny to spike his drink. What? We asked. Did he think they might have spiked his drink with speed? He says. What do you know? Bloods confirmed that he had taken speed. But he insists he didn't take it. His drink was spiked. I'm a CT tech and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask none, so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it and demanded a blood test, since she was a lesbian and never has with men. Well, the blood test came back positive also. Surprise. And the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. Edit, because I've gotten this comment a lot. The woman in the room with the patient was a Sue and they had been together a long time, and the patient had given her so permission, in writing, to allow her to hear her medical information. Many of you are saying you shouldn't have told her in front of her, so and you're partially right in a way, but the patient had given her so that permission, and I did not question it. Had she not, I would have asked her so to leave the room. You can give anyone you deem necessary access, or no access, to your medical information. It's not limited to spouses. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. Had a patient refuse to admit he swallowed a pen, even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. When was their last meal? They think they can fool their PET scan, end up losing money, time and over irradiated. I volunteer at an ER. Prisoner shoved a ballpoint pen up his urethra to get out of being stabbed. Ike insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. Saw one guy who actually got stabbed and he was so oddly relaxed about the whole thing. Making jokes, normal BP, heart rate only like 80. Prison must be insane. It's well known in the ER that a patient with something stuck up his or etc but has no idea how it got there. Or they fell on it. The weirdest thing I saw was a patient who came into the ED with a shampoo bottle up his butt. So, what brings you into the emergency room tonight? I shoved a shampoo bottle up my butt, now it's stuck there. No shame. I mean, you kinda gotta respect that level of honesty. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her vaginal filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying I think this is all a joke and you put it up there. All the symptoms of pregnancy plus 2 positive pregnancy tests. There's 0% chance I can be pregnant. I'm not married to be fair. The patient's mother was there and this was in a very conservative country. She ended up admitting she was pregnant when we separated her from the mom. I can literally smell the smoke on your clothes and breath, see the nicotine stains on your fingers, and you're trying to tell me you quit smoking 10 years ago? I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart, or any other surgery. Not a doctor but my husband. He had a 17-year-old girl with abdominal pains come into the ER with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant, she's a virgin. The baby is literally crowning right there in ER. No maternity ward in their hospital and she was in advanced labor when she arrived, and she still insists she's a virgin. Edit, poor wording. My husband was the doctor, not the 17-year-old girl. Not a doctor, but a nurse. When you come into the hospital wanting to detox, and I ask you how much you drink, please stop lying to me. Withdrawal from alcohol is nasty but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later when you aren't having a seizure. You weren't breathing. We gave you Narcan. You started breathing again, woke up, and then deny you used a narcotic. Yeah, alright. How a 20-ounce glass Coke bottle was lodged all the way up a guy's rectum. He denied it vehemently in front of his wife. That was weird. And awkward. Maybe his wife really likes Pepsi. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and amp, pointed him to the bathroom. I went to check on my other patients and amp, came back, kid was still in the bathroom. I go knock on the door. Hey buddy, you okay in there? Sink on full blast Yep. Everything's fine. I go back to his room a few minutes later and amp. He hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy, are you sure this is urine in this cup? Yay. My pee is always clear. PT is wheeled off the x-ray. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie, you gotta do better than that. I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for cocaine. After the rest of his cardiac workup was negative, I said to him, good news, you didn't have a heart attack. It's likely that your chest pain was caused by cocaine. His answer, I didn't use cocaine. See, I was at a party and people had some lines of cocaine out on a table. As I was walking by, an oscillating fan blew the cocaine into my face, which is why my urine was positive. MMMHMM. Got it. Not a doctor, yet, but was volunteering in the emerg ward and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff.